I'm John Chessare, the President and CEO of the GBMC Healthcare System, and I want to give you our weekly update on the COVID-19 pandemic and the situation at GBMC. Right now, we have 14 patients in the hospital who have already tested positive, and we have another 13 who we are investigating and awaiting test results, which is pretty much the same as the situation has been for the past couple of weeks. I want to thank everybody in the community for washing your hands frequently and maintaining the social distancing. It is because of these actions that we have had a blunting of the peak of disease in the community. We cannot let down our guard. The hospital will continue to serve the community in the ways that we have been serving as we get ready for the next phase, which will include case finding and contact tracing. So you will be hearing those terms, case finding and contact tracing, a lot. The governor yesterday announced that he is authorizing the hiring of 1,000 people to go out into the community and trace the contacts of people who become positive. This will be necessary before any releasing of the social distancing can happen safely. We need to be ready to isolate individuals that become positive in order to not go back to the state we were in a couple of weeks ago, fearful of a large surge of patients. Again, the pandemic can only end when we get to 95% of people in the community that are immune to COVID-19, and that will only happen when we get the immunization that we are not likely to have for another year. But we will be able to relax the social distancing once we have the public health measures in place to isolate every new case and then do contact tracing of those new cases to keep the rate of disease down in our community until we get the immunization. Starting tomorrow at GBMC, we will be making two significant changes. First, we will be requiring that all people reporting for work at GBMC have their temperature checked on arrival. We will have stations at a couple of our main entrances to do that. Once you are screened negative for fever, you'll get a sticker, and you will not need to be screened again until the next day that you are arriving for work. The second significant change is we will begin requiring facial coverings at all places in our buildings. Up until this point, it has been suggested that people wear a mask or a covering over their nose and mouth, and beginning tomorrow, Friday, we will require that. We believe that as the information changes, we should maintain our vigilance, and facial coverings, once again, are not to protect the individual wearing the facial covering, but to protect others in case the individual with the facial covering is infected but does not yet have symptoms and therefore doesn't know it. So let me end by saying thank you to the fabulous supporters of GBMC in the community. Thank you for your gifts to GBMC. We're all putting on a few pounds because of the amount of food that is being delivered to our people. And again, thank you for washing your hands and maintaining the social distancing. Hang in there. I know everybody is tired of this. We will get through this together. And as always, I want to tell you, GBMC is here for you if you need us.